children really suffer from depression? Yes. Childhood depression is different from the normal blues and everyday emotions that occur as a child develops. Just because a child seems sad doesn't necessarily mean he or she has significant depression. If the sadness becomes persistent, or interferes with normal social activities, interests, schoolwork, or family life, it may indicate that he or she has a depressive illness. Keep in mind that while depression is a serious illness, it is also a treatable one. How can I tell if my child is depressed? The symptoms of depression in children vary. It is often undiagnosed and untreated because they are passed off as normal emotional and psychological changes. Early medical studies focused on masked depression, where a child's depressed mood was evidenced by acting out or angry behavior. While this does occur, particularly in younger children, many children display sadness or low mood similar to adults who are depressed. The primary symptoms of depression revolve around sadness, a feeling of hopelessness, and mood changes. Which children get depressed? Up to 3% of children and 8% of adolescents in the U.S. suffer from depression. Depression is significantly more common in boys under age 10. But by age 16, girls have a greater incidence of depression. Bipolar disorder is more common in adolescents than in younger children. Bipolar disorder in children can, however, be more severe than in adolescents. It may also occur with, or be hidden by, attention deficit hyperactivity disorder, ADHD, obsessive compulsive disorder, OCD, or conduct disorder, CD. What causes depression in children? As in adults, depression in children can be caused by any combination of factors that relate to physical health, life events, family history, environment, genetic vulnerability, and biochemical disturbance. Depression is not a passing mood, nor is it a condition that will go away without proper treatment. Can depression in children be prevented? Children with a family history of depression are at greater risk of experiencing depression themselves. Children who have parents that suffer from depression tend to develop their first episode of depression earlier than children whose parents do not. Children from chaotic or conflicted families, or children and teens who abuse substances like alcohol and drugs, are also at greater risk of depression. How is depression diagnosed in children? If the symptoms of depression in your child have lasted for at least 2 weeks, you should schedule a visit with his or her doctor to make sure there are no physical reasons for the symptoms and to make sure that your child receives proper treatment. A consultation with a mental health care professional who specializes in children is also recommended. Keep in mind that the pediatrician may ask to speak with your child alone. A mental health evaluation should include interviews with you, the parent or primary caregiver, and your child, and any additional psychological testing that is necessary. Information from teachers, friends, and classmates can be useful for showing that these symptoms are consistent during your child's various activities and are a marked change from previous behavior. There are no specific tests, medical or psychological, that can clearly show depression, but tools such as questionnaires, for both the child and parents, combined with personal information, can be very useful in helping diagnose depression in children. Sometimes those therapy sessions and questionnaires can uncover other concerns that contribute to the depression, such as ADHD, conduct disorder, and OCD. Some pediatricians start using mental health screens at a child's 11th year well visit and each year after. What are the treatment options? Treatment options for children with depression are similar to those for adults, including psychotherapy, counseling, and medication. Your child's doctor may suggest psychotherapy first, and consider antidepressant medicine as an additional option if there is no significant improvement. The best studies to date indicate that a combination of psychotherapy and medication is most effective at treating depression. Depression in children, warning signs. Parents should be particularly vigilant for signs that may indicate that their child is at risk for suicide. Warning signs of suicidal behavior in children include many depressive symptoms, changes in eating, sleeping, activities, social isolation, including isolation from the family, Talk of suicide, hopelessness, or helplessness. Increased acting out of undesirable behaviors, sexual, behavioral. Increased risk-taking behaviors. Frequent accidents. Substance abuse. Focus on morbid and negative themes. Talk about death and dying. Increased crying or reduced emotional expression. Giving away possessions.